Hello, and welcome to Know Your Numbers Part 3, Interpreting Your Lab Results. My name is Lauren, and I'm a registered dietitian with Rock Valley Health. Here today to conclude our video series that includes an in-depth overview of the lab results that you get completed as part of your health assessment with Rock Valley Health. So again, I hope that by the end of this video series, you have a better understanding of what those lab results are, what they mean, and how to interpret these lab values to improve your overall health and wellness. So let's get started. So the next part of the lab values that you get completed with Rock Valley Health is a lipid panel. And this includes your total cholesterol, your LDL cholesterol, your HDL cholesterol, and your triglycerides. And we're going to go over all of these in depth here. They're all essentially just different types of fat in your bloodstream. A lot of people think cholesterol is bad, but it actually has a good helpful benefit to our bodies. Cholesterol actually helps build healthy cells in your body. So we'll talk about there's a bad type of cholesterol and a good type of cholesterol. And if you have healthy levels of cholesterol in your bloodstream, it actually is beneficial to help build those healthy cells in your body. However, too much cholesterol or too much fat in your blood, this can cause an increased risk for heart disease, heart attack, and stroke. And so when you're getting this lipid panel completed to look at those cholesterol and triglyceride values, it's really important that you fast for 10 to 12 hours before you get these lab results taken so that you can have accurate results. All right, so the first value as part of the lipid panel is your total cholesterol. Ideally, a normal cholesterol value is less than 200. And I always ask when getting someone's cholesterol measurements done if they have a family history of total cholesterol, because unfortunately, no matter what you do in terms of lifestyle factors, that family history of high cholesterol or heart disease can still be pushing against you a little bit. So if that's the case, your doctor may prescribe medications called a statin that can help maintain healthy cholesterol levels, especially if you have that permanent family history. And I also wanted to mention it is a pretty outdated misconception at this point that you should focus on decreasing your dietary cholesterol intake to help lower your blood cholesterol levels. The current research these days has kind of disproven this fact that you shouldn't really need to worry too much about the dietary cholesterol in foods to help lower your blood cholesterol. A classic example of this that I think the average American is confused about is eggs. A lot of misconception of this is outdated research about the cholesterol values in eggs. You shouldn't eat eggs because the cholesterol in them increases your blood cholesterol. But again, that has been disproven. You shouldn't really need to worry about the cholesterol levels in eggs. That's a question I get asked very often because the cholesterol levels that are in eggs, that doesn't really impact your blood cholesterol too much. So I always recommend having one egg a day in moderation is totally fine. It's a good source of protein, lots of different vitamins and minerals. So there's nothing wrong with eggs in terms of your cholesterol. All right, so the next part of the lipid panel is your LDL cholesterol. This is also known as your bad cholesterol because this leads to cholesterol buildup in your arteries. There are a few different recommended ranges for the LDL cholesterol based on your risk factors and if you already have heart disease and diabetes. So we ideally want your LDL cholesterol to be less than 100. This is if you already have heart disease or diabetes. We want your LDL cholesterol to be less than 130. If you are at average risk for heart disease, which is most Americans, this is the most common recommendation. And then we want your LDL cholesterol to be less than 160 if you are at low risk for heart disease or no, you don't have any family history. All right, so two main points here regarding dietary changes to lower your total cholesterol and your LDL cholesterol. We already talked about how you don't really have to worry too much about the dietary cholesterol values in foods and how it's totally okay to have eggs in moderation. So the two things we really want to focus on for lowering those cholesterol numbers is consuming less saturated fat and increasing your fiber intake. So first off, with less saturated fats, these are unhealthier fats. We want to focus on eating more lean meats, things like chicken, turkey, and higher percent lean ground beef. Cuts of meat with loin or round in the name are going to be leaner choices as well. These are things that you can swap out instead of red meats and processed meats because those meats are going to have a lot higher saturated fat content. And also an easy swap is choosing lower fat dairy products, things like skim or 1% milk instead of 2% or whole milk, doing reduced fat cheeses. Cheeses is a really big source of saturated fat in the average American's diet. So doing the reduced fat option there is helpful. And then choosing non-fat or skim yogurt is also another option. And then lastly, for saturated fats, we want to focus on minimizing your intake of desserts and sweets, just having those in moderation, maybe focusing on having those 1 or 2 times a week instead of every single day or multiple times a day, unfortunately, with some people. Um, and the desserts and sweets do have a lot of the unhealthier fats and the saturated fats. So really focusing on minimizing your intake of those can be beneficial for your cholesterol as well. And then second point here is increasing your fiber intake. I like to think of fiber as a sponge that can help soak up all the bad cholesterol in your bloodstream. A lot of people know fiber is beneficial for your digestive health. It's also beneficial for your cholesterol. So things like fruits, vegetables, choosing whole grains, whole wheat products instead of the plain white refined breads and pastas, doing whole grain and whole wheat pastas, whole grain and whole wheat breads, things like that. And then beans are also a good source of fiber. And also, if you don't think you're getting enough fiber from your diet, from these food groups, there's also fiber supplements like Metamucil and things that you could consider to help support healthy cholesterol levels. But it's also important to note too that as you're increasing your fiber intake, you want to also increase your water intake because, as we all know, fiber does help keep you regular. So increasing your water intake can help balance that out. All right, so our first question here for our knowledge break is what dietary changes can you make to help lower your total and LDL cholesterol? Is it A, eat more refined grain products, B, consume leaner meats, low fat dairy, fruits and veggies, and whole grains? Is it C, avoid eggs because they are high in cholesterol? Is it D, eat more reds and processed meats? Or E, none of the above? So the next value as part of your lipid panel is your HDL cholesterol. This is known as your good cholesterol because it actually helps prevent that bad cholesterol, that LDL cholesterol, from building up in your arteries. And it takes this bad cholesterol to your liver, which is then actually broken down and eliminated from your body. So this kind of acts as like a vacuum to help eliminate that bad cholesterol in your bloodstream. We actually want these values to be higher. So the higher, the better for your HDL cholesterol. For men, we want your HDL cholesterol to be higher than 40. And for women, we want your HDL cholesterol to be higher than 50. So moving on, here are some dietary and lifestyle changes to help increase your HDL cholesterol if your number is below the recommended values. So we really want to focus on eating more of those unsaturated fats and omega-3 fats, as opposed to the saturated fats. These are the healthier fats that help increase that HDL cholesterol. So things like seafood, nuts and nut butters, using olive oil instead of butter, avocados, choosing omega-3 eggs, and also chia and flax seeds are really good plant sources of these healthy fats. And also, if you don't like seafood or don't think you consume a lot of these healthy fats regularly, I usually recommend taking a daily omega-3 or a fish oil supplement because this is a supplement that, if you take it consistently for at least a few months, that can help gradually increase your HDL cholesterol. And also, a lifestyle change that you can consider is regular physical activity, regular aerobic activity, something that really gets your heart rate up, can help improve that HDL cholesterol as well. So, question number two, what dietary changes can you make to help increase your HDL cholesterol? Is it A, use coconut oil instead of butter? B, eat more seafood, nuts and nut butters, and avocado. C, increase fiber intake. D, eat more saturated fats. Or E, none of the above. So the next value here as part of your lipid panel is your triglycerides. And your triglycerides are a type of fat in your bloodstream. They actually help store excess energy from your diet. And so if you have too much fat in your bloodstream or a high triglyceride level, this can lead to potentially hardening of your arteries. And so a high triglyceride level in combination with a high LDL cholesterol and a low HDL cholesterol that we've talked about, these three things combined can really increase your risk for heart disease and stroke. So it's really important to make sure you know if your numbers for these are in the recommended ranges. And the recommended range for your triglycerides is less than 150. So there's a variety of different dietary and lifestyle changes you can make to lower your triglycerides. First thing is focusing on minimizing your fast food intake, having less fried foods, having less of those processed snack foods, things that don't have a lot of fiber or protein, and minimizing your intake of desserts and sweets. And then you also want to watch out for added sugars. These added sugars, minimizing that is not only beneficial for your blood sugar, but also for your triglycerides. The general recommendation is less than 50 grams per day of added sugars. This is for a 2,000 calorie diet. So if you're a female or someone who is a little bit lower weight who might not require 2,000 calories a day, if you're focusing on weight loss and creating a little bit of a calorie deficit, you probably want to focus on having more like around 40 or less grams per day of added sugars. And it's really helpful too that just within the past 5 years or so, the nutrition facts labels have changed to include added sugars on the nutrition label beneath where it says total sugars. So I always recommend looking at that added sugar listing on the nutrition facts labels. And usually for most products, you want to look at something that has less than 10 grams of added sugar per serving. And obviously cutting out pop, a lot of Starbucks drinks and things like that can have a lot of added sugars. So cutting those things out can be helpful to minimize your added sugars to help lower your triglycerides. And then also similar to what we talked about for your HDL cholesterol, we want to choose healthy unsaturated fats to help lower your triglycerides. So fish and seafood, olive oil versus butter, nuts and nut butters, avocado. And then also, this is important for your triglycerides as well, is focusing on fiber. So again, fruits, veggies, whole grains, as opposed to the refined white grains. And then also important to consider to help lower your triglycerides is having alcohol in moderation. Excess alcohol intake can really impact your triglycerides in a negative way. So alcohol in moderation is defined as 2 drinks per day for men and 1 drink per day for women. So just being mindful of that. And then also regular physical activity can also help lower your triglycerides. So question number 3, what dietary and lifestyle changes can you make to help lower your triglycerides? Is it A, minimize your intake of fast food, fried foods, desserts and sweets, and added sugars? B, focus on eating more fiber and healthy fats? C, incorporate regular physical activity? D, have alcohol in moderation? Or E, all of the above? All right, so moving on from our lipid panel, the next value as part of your lab results is your A1C. This correlates with your fasting glucose or your fasting blood sugar levels. Your A1C is actually a 2 to 3 month average of how your blood sugar levels are being controlled during that time. So it's more of a long-term indicator of diabetes risk and more of a accurate measurement of how your blood sugar is being controlled. That fasting glucose is kind of more of a one-time snapshot of your blood sugar, but your A1C is a really good indicator of your long-term diabetes risk. Most doctors will recommend if you are pre-diabetic or have a family history, or if they see that your fasting glucose is kind of creeping up, they'll have you get your A1C tested every 3 to 6 months. or maybe just once a year. So if your fasting glucose is in that pre-diabetic or diabetic range, your A1C kind of usually goes along with that. It's usually also going to tend to be in that pre-diabetic and diabetic range. So for your A1C, we recommend to be less than 5.7%. The values are in percentages here. And then that pre-diabetic category for your A1C is anywhere from 5.7 to 6.4%. And then greater than 6.5% indicates a diabetes risk or someone who already has been diagnosed with diabetes. Um, Usually a goal for them is to have that A1C be less than 6.5, but anything greater than that is considered the diabetic category. All right, so the very last value here is part of all of your lab values that you are getting completed with your health assessment with Rock Valley Health is a urinalysis. So this is a urine test that can be used to detect a variety of diseases and actually indicates how your body metabolizes nutrients. So there's a few different indicators here that the urinalysis looks at. So if you have a high concentration of your urine, this can usually be caused by dehydration. If you have high protein levels in your urine, this usually indicates some sort of kidney problem. If you have high glucose or ketone levels in your urine, or this just means that you have high sugar levels in your urine, this is usually an indicator of diabetes. If you have high bilirubin in your urine, this is usually an indicator of liver damage or disease. If you have a high white blood cell count in your urine, this is usually a sign of a UTI or some sort of infection. And if you have blood in your urine, obviously that's not a good sign. This usually is indicative of possible kidney issues. So the last question here to wrap things up is which of the following is not measured by your urinalysis? Is it A, diabetes risk, B, presence of a UTI or any kind of infection, C, kidney or liver disease risk, D, cardiovascular disease risk, or E, hydration status? So that wraps up all of our lab value overview for the lab values that you get completed as part of your health assessment with Rock Valley Health. I hope that by watching this video series, you have a much better understanding of what all those lab values mean and can interpret them a little bit better to start to make some changes to improve your health and wellness. So thanks again for watching. You'll test your knowledge with a post-video quiz next.